About 2005, 2006 is whenever I had my teeth worked on. They had to drill for cavities, etc. And they had put a desensitizer material on my teeth after they had drilled them. And it had glutaraldehyde in it, which I had no idea was a neurotoxin. I did not know it could poison a person. But it took me about a year after that to finally realize what was going on, because I started seizuring about 4 hours a night, and I was having a lot of difficulty. Still had no idea that it was the glutaraldehyde that was on my teeth. And then eventually I found out I had Lyme's disease from that. Well, I had Lyme's disease and then Epstein barr and a whole bunch of other things after I had my teeth done, like I said, about a year later. I came to Dr. Sprinkle to figure out what is going on with my teeth, and he had muscle tested me and found out that it was the glutaraldehyde. We had to take out all of my fillings. It took about 2 years, and then we had to remove the desensitizer material also from my teeth, and it took quite a while. But as soon as the desensitizer material was removed from my teeth, my seizures went from 4 hours to practically none at all every night. So I was about 90-something% over my seizures. The rest of the time it was basically the Lyme's disease and the Epstein barr. But once we were able to take care of that, my seizures probably are only about 0.5% now of what they used to be. So.
Prior to 2005, my wife was very athletic, kind of an all-around sports person. She loved doing rollerblading, running, cycling, swimming, basketball, you name it. Sometime in 2005, 2006, she had some dental work done with 8 fillings being put in to take care of some cavities. That was the first dental work she'd had done in her life. And shortly thereafter, in spring, summer of 2006, she started having a lot of exhaustion and weakness. We ultimately found out after several years of going to different doctors and trying different things that she had Epstein barr and Lyme's disease, hepatitis, and a few other things. We were introduced to Dr. Sprinkle through another medical practitioner, and determined that some of the problem was the glutaraldehyde that the other dentist had used to desensitize her teeth for the fillings. And over the course of 2 years, Dr. Sprinkle was able to drill out the cavities, the fillings, remove the glutaraldehyde, and eventually get us to the point where my wife was no longer having the major seizure issues that had come along with her other health problems. And where she was at the point when we first saw Dr. Sprinkle, we had to carry her in here literally in a wheelchair. By the time we were done with Dr. Sprinkle, she was back to walking, and she's now helping raise our 5-year-old daughter.